Hello guys, this is the Group 6 Gerontology final presentation. So in this presentation, we're going to be talking about delirium in older adults. So what is delirium? Delirium is a serious disturbance in the mental abilities that results in confused thinking and reduced awareness of the environment. It is also an abrupt onset and is potentially reversible if caught early. It is the most common complication in hospitalized clients 65 and older. Now, what causes delirium? Delirium generally occurs due to medical conditions. Certain medical conditions such as systematic infection, metabolic disorders, fluid and electrolyte imbalances, liver or kidney disease, postoperative states, head trauma can cause symptoms of delirium. We can also have a substance-induced delirium. Substance-induced delirium, this is a symptom of delirium that can be induced by exposure to a toxin or ingestion of medications such as anticonvulsants, neuroleptic, anxiolytics, antidepressants, cardiovascular medications, and antineoplastics, analgesics, anti-asthmatics agents, antihistamines, anti-Parkinsonian drugs, corticosteroids, gastrointestinal medications. There's another type of delirium called the substance intoxication delirium. This delirium symptoms can occur in response to taking a high dose of cannabis, cocaine, hallucinogens, alcohol, anxiolytics, or narcotics. We also have a substance withdrawal delirium. This type of delirium occurs due to reduction or termination of long-term, high-dose use of certain substances, such as alcohol, sedatives, hypnotics, anxiolytics, and this can result in withdrawal delirium symptoms. There could be a one or more symptom of delirium. This type of delirium may be related to more than one general medical condition. The combined effects of a general medical condition and substance use. So what are the signs and symptoms of delirium? There's a reduced awareness of the environment. This may result in an inability to stay focused on the topic or to switch topics. Getting stuck on an idea rather than responding to questions or conversations. Being easily distracted by unimportant things. Being withdrawn with little or no activities or little response to the environment. There's another symptom of delirium that is a poor thinking skills or cognitive impairment. This includes poor memory, particularly in recent events, disorientation, for example, not knowing where you are or who you are, difficulty speaking or recalling words, rambling or nonsense speech, trouble understanding speech, difficulty reading or writing. Behavioral changes. What are some behavior changes you can see with delirium? This may include saying things that don't exist, like hallucinations, restlessness, agitation, combative behavior, calling out, moaning or making other sounds, being quiet, withdrawn, especially in older adults, slowed movements or lethargy, disturbed sleep habits, reversal of night-day sleep-wake cycle. Another category symptom of delirium is the emotional disturbances. This may appear as anxiety, fear, paranoia, depression, irritability or anger, a sense of feeling of elated, like euphoria, apathy, rapid or unpredictable mood shifts, personality changes. So there are different types of delirium. There is a hyperactive delirium. This is often referred as the quiet delirium. It is the most common type and has a high mortality rate. Symptoms may include lethargy, inattention, or somnolence. Another type of delirium is the hyperactive. This is the most recognized and manifests as agitation, confusion, or perceptual disturbances such as hallucination or delusions. Agitation may be present as restlessness, attempts to climb out of bed, elope, aggression, combativeness of pulling a tubes or catheters. There's a mixed type of delirium. The most frequent subtype present with both hyper and hyperactive symptoms may have daytime somnolence with nighttime agitation or insomnia. Some may fluctuate between hyper and hyperactive in a span of few hours. So what is the difference between delirium and dementia? So delirium is usually abrupt, while dementia usually is insidious, abrupt in some stroke or trauma events. So what's the course or duration? Course fluctuates while in delirium, while in dementia there's a slow decline. Duration of delirium is hours to weeks, while dementia is months to years. Attention in delirium is impaired, while in dementia is intact early and often impaired late. Sleep-wake cycle. Sleep-wake in delirium is disrupted, while in dementia it's usually normal. Alertness in delirium is impaired, while dementia is normal. Orientation in delirium is impaired, while dementia is intact early and impaired late. Behavior in delirium is agitated, withdrawn, or depressed, or combination of both, while in dementia is intact early. Speech in delirium is incoherent, rapid, or slowed, while in dementia, word-finding problems occurs. Thought process in delirium is disorganized illusions, while in dementia is impoverished. Perception in delirium is a hallucination or illusions, while dementia is usually intact early. So who can become delirious? A person of any age, when acutely ill, may experience delirium and acute confusion. However, in older adults, usually at higher risk than younger adults. And older adults with pre-existing dementia are at higher risk of developing delirium when acutely ill or injured. So what is the delirium prevalence? According to the article presented above, in the United States, more than 2.6 million adults and 65 years and older each year develop delirium and account for an estimated more than $164 billion in annual healthcare expenditures. Delirium assessments. So how do we assess for delirium? According to the article above, confusion assessment method known as the CAM is a tool that was developed by the reference above to help nurses identify delirium quickly and accurately using the 4 basic features of delirium. What are the features? Acute onset of fluctuating course, inattention, disorganized thinking, altered level of consciousness. The diagnosis of delirium is present if 1 or 2 are positive, along with either 3 or 4 being positive. How to prevent delirium in older adults. According to the article, the most effective way to prevent delirium in older adults includes early mobilization, adequate hydration, sleep enhancement, orientation to time and place, therapeutic activities such as reminiscing, and hearing and vision optimizes by using hearing aid or visual aid as needed. To identify risk factors in early stages of delirium in older adults, bedside nurses play a critical role. The accurate assessment of CAM2 is vital research. If positive, needs to be reported to the physician as well as initiating prevention strategy. In order to treat delirium, the cause must be first identified. Treatment of delirium is individualized to the patient, as no 2 people may be experiencing the same symptom or may have the same cause of delirium. So what is delirium medical evaluation? According to the article, some of the medical workup to identify the cause of delirium includes some laboratory workup, physical examination, imaging if trauma is suspected, and careful review of the patient's medication. Delirium nursing intervention. So what can we as nurses do to prevent delirium? According to the article, one of the main goals of nursing care for delirium is to prevent further complications from developing during acute syndrome, and keeping the patient safe is priority. The use of restraint is not recommended because it could cause more agitation and result in more injury. If patient is experiencing any symptoms that need to be treated appropriately, such as treating pain, providing oxygen and IV fluids, ambulate patient when appropriate to prevent pressure ulcers. Encourage fluid intake to prevent dehydration. Offer meal assistance if patient is unable to feed themselves. Avoid any invasive procedures. Provide reassurance and reorientation frequently. Provide safe and quiet environment. Promote sleep and rest. So attached below is a few links, video links that show you a visual description of what delirium looks like. Take some time out to watch the videos, as these are useful tools to help you recognize delirium in your patients. I hope this presentation has been useful to provide some insights on what delirium is about and what type of people can get delirium and some of the signs and symptoms of delirium. Thanks for listening. Have a great day.